Dr. Imtiaz Ghani, consultant spine surgeon working at the Apollo Main Hospital in Chennai City. Today we are going to discuss an important topic about how do we maintain spinal health in children and when does a child with a hunched back or an S-shaped deformity, what we call as kyphosis or scoliosis in the medical terms, when do they really require surgery? Children are more prone for faster growth and things like that. So whenever you suspect a deformity, more like a hunched back, or whenever the parent notices an S-shaped deformity, immediately it is mandatory that you bring the child and consult with the spine surgeon to know as to how severe is the deformity and when the child has to be intervened. Not all hunched backs or not all S-shaped deformities do require surgery. So we'll have to understand, we'll have to plan the treatment protocol in general, and also make sure that your child is fit and healthy and not obese towards the obese side. Being obese is going to cause more of spinal issues and it is going to camouflage the deformity that the child is having, and we will not be able to see it better. Okay? When a child is having a deformity that is like say only around 5, 10 or less than 25 degrees, generally it is not mandatory for a surgery. So what we do is we try to use a brace, more like a belt support, which is worn almost 22 to 23 hours a day in order to maintain that deformity in the child from progressing. However, when the deformity of the child, say the hunchback is more than 50 degrees and the deformity like the S-shaped deformity, if it is more than 50 to 60 degrees, that's when we decide on surgery. When we talk about surgery, parents do panic. They do think that like, okay, will my child get paralyzed? Will the child face any other problems? Will she lead a normal life? In future, when she's going to get married, he or she is going to get married, will they lead a normal life? The answer is yes. They can definitely lead a very, very normal life. And today we have a wide array of treatments, meaning like we have robotics which we use these days for spine surgeries. We have non-fusion procedures for correction of deformities like scoliosis, and of course we have our traditional fusion procedures. However, we need to understand which child requires what before we decide on the treatment plan. But then when there is a severe deformity, my personal request to all parents is that kindly evaluate the child and don't panic and don't leave the child to live with such a hunchback or an S-shaped deformity.